Hello and welcome to 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm your host, Rob Hoyle, joined by my co-host, Chris Gazewski, as always. And today our very special guest is Dr. Tara Narula. She's a cardiologist, and she's also the Associate Director of the Lenox Hill Women's Heart Program. And she is extremely busy because she's also the Senior Medical Correspondent for CBS News. She's joining us virtually today. Thank you so much, Dr. Narula, for joining us. So you've had the unique aspect of covering COVID for the news and also treating patients. What has this last year been like for you?
It's been an incredibly interesting year that I don't think any of us will ever forget. But certainly, let me just start by saying, as a journalist, it was something that I think we are all prepared for, in the sense that we're always reading about breaking news and research studies and trying to report and inform the public in a way that's clear and accurate. But that took on really much more importance, I think, with COVID, because there was such a hunger for accurate, clear, understandable information, particularly in those first few months when it just seemed like we were learning more and more about the disease each hour of every day. I remember just being, on my phone, constantly reading through email after email about breaking news from, China or a new study in the United States. And so trying to stay on top of everything and really pick out what were the important things that we needed to highlight to the American public was probably the biggest and most important challenge. And, for me, I think in those first 4 or 5 months, one of the things that really emerged was the issue around PPE, and really hearing from so many frontline workers around the country, basically screaming out that they did not have adequate PPE and wanting to get their voices heard. And then there were specific science issues that emerged over time, the cytokine storm and clotting issues related to COVID. So it was really incredible to be at that forefront of information that was coming in, and to make sure that we were conveying it to the public in a way that made them feel safe, made them feel that they were getting correct information, and did not make them feel panicked.
We needed you in that position. We needed that calming voice to explain things to in a way that we could understand it. Are there any stories that stand out in your mind that maybe was a turning point or that gave hope?
I mean, I have to say, the clapping every night was something that I personally wrote about on my social media, because it impacted me so much. My husband and I live with our 2 kids in an apartment in New York City, surrounded by other apartment buildings. And, every night at 7 p.m., we would hear that clapping. And I remembered one night being in my kitchen, and the song by Louis Armstrong came on, "What a Wonderful World." And I just started crying. It came on at the same moment that I heard the clapping. And I think it was just this feeling of, no matter what was happening and how our world seemingly was falling apart, and there was so much separation and so much fear, that there was still so much joy and beauty, and how our city came together for those healthcare workers who were showing up every single day with such courage.
Yeah, I think you touched on that. I was going to ask if has your journalism career, influenced cardiology for you, or vice versa? It sounds as if the connection has been the connection.
Absolutely. And I know when I first started working as a medical correspondent, and it was so important to me to continue to practice medicine, because both of them really inform each other. And I really can't imagine doing either job alone, because certainly when I see patients and I'm talking to them, so much of what they tell me and those experiences and our interactions and my work with them ends up translating into what I feel is important to report on, because I'm hearing it from my patients, or what they're asking me and they want to know about, or just even how we talk about the science, how I explain it to them. So that work as a doctor, I definitely bring to my role as a journalist. And then what I cover in the news is so critically valuable for the questions that my patients then ask me, for example, about the COVID vaccine, and why should I take it? And are you concerned about the side effects? How much research has been done, or about the risks to the heart? So what I learn, because I have to learn it for reporting, all of the breaking news, I'm able to then bring back to the office and talk to my own patients about and help inform them.
Did you get your vaccine?
I did. Another emotional day when I started crying was with my first shot. It just was overwhelming after, again, everything that we had been reporting on and I had been seeing and hearing from my patients and just living through this as a human being in New York City, to be sitting there and getting that shot it was such a momentous moment. I don't know how to say it, but it was an incredibly powerful moment in my life to know that we had in 1 year reached a point where we went from complete fear and anxiety over what is happening to we actually have a way to prevent people from getting sick and dying with the vaccine. So I was very proud to get my shot and very happy.
Dr. Narula, when we introduced you earlier, we mentioned that you're the Associate Director of the Women's Heart Program at Lenox Hill Hospital. Just tell us a little bit about that program and what it offers.
Right. So we have a really unique program here in Manhattan. We have an incredible collection of female cardiologists who really we have brought together to specifically focus on women's cardiovascular and heart health. And so what we like to promote about our program is that we take a very personalized approach. And so it is not the type of center where a woman is going to come in and get 50 million tests run, but rather one where she will sit one-on-one with a cardiologist who really gets to know her as a human being and every facet of her. Another thing that we've been focusing on lately is also building support for women who may be interested in the field of cardiology and pursuing a career as a cardiologist. Dr. Eugenia Giannos, who is the director of our Lenox Hill Women's Heart Program, and I really felt like there has been an issue with lack of female mentorship in the cardiology community for younger generations of women who are coming up and may be interested in cardiology. We are meeting with medical students, with residents, with fellows who are female, and offering to connect them to our female cardiology attendings so that they can build a mentoring relationship should they have questions about things like promotions or salary discussions or different paths within the field that they may want to take, for example, medicine and media, as I do, or medicine and business, as one of my colleagues does. So we really want to show women that this is something they can do. It's an amazing field, and we want to support them. And so we have